Hello, my name is Gary Brown. I'm the Communications Director with the Philadelphia Department of Behavioral Health and Intellectual Disability Services. And I'm here with Ricardo Tull.
How are you, Gary?
I'm well.
Great to see you.
Good to see you as well. And Rick's the Program Manager with the Access to Recovery Program, and Rick's going to share with us today a little bit about the program and how it works. So Rick, tell us, what is the Access to Recovery Program? What is it?
Well, Gary, Access to Recovery is a SAMHSA, Substance Abuse and Mental Health Service Administration, funded initiative that's been around since 2004. Here in Pennsylvania, the Department of Drug and Alcohol Programs received a grant from SAMHSA in 2010 for $11.8 million over 4 years. The county that was targeted for this intervention was Philadelphia County, so Philadelphia is the sole county with access to recovery. The intent of the program is to provide expanded access to clinical treatment, as well as offer recovery support services to people with primary substance use histories and challenges. Here in Philadelphia, we're targeting 10,705 people over the course of the 4 years. So the program has actually been in existence here in Philly County for 2 years. We're in the third year of the grant at this particular point, and really there's a great demand for services in the community.
I'm sure. So what are the finer points of ATR? What are the specific goals?
Well, some of the key features of the program are that individuals have a choice of recovery support services. So we have a host of 18 services, which include adult basic education, GED preparation, anger management, employment vocational skills training. One of our top sellers is short-term emergency recovery housing, and a host of other services that make it easier for people to maintain their recovery in the community. Our specific goals are to offer people expanded access to treatment if they need it, and recovery support services so folks can maintain their recovery over longer periods of time. Some of the other essential features of this particular program are that we're doing a survey called the Government Performance and Results Act Survey, GPRA for short. So at baseline, when we bring people into the program, we're evaluating them via this survey instrument to determine their substance abuse patterns over the course of the past 30 days. We're offering folks recovery support services based on their choice for up to 6 months. And then at the end of the 6-month period, we're doing a follow-up GPRA survey to see if the intervention changed behavior. Now, this program also features 25 recovery specialists who the department has hired to follow people over the course of the 6-month ATR journey. These recovery specialists have lived experiences. Many of them are in recovery, and they can really relate to the individuals that we enroll in the program.
So, if you can describe some of the functions of a recovery specialist, it's wonderful they have lived experience. So, day to day, what's it like for a recovery specialist who works in the ATR program? What do they do?
Well, our program has an infrastructure that features 22 evaluation sites that are based in the community. The Department of Behavioral Health Office of Addiction Services has actually solicited licensed clinical treatment providers and non-clinical providers in the mix of the 22 evaluation sites. So currently we have 25 recovery specialists. So I have one specialist assigned to each of the evaluation sites to recruit people for access to recovery, promote the program, conduct initial evaluations of the individuals being enrolled in the program, and also follow those individuals over the course of the 6-month ATR journey. Now, the program also has a key hallmark, and that hallmark is that we're using vouchers to pay for services that people have selected. So we also have probably 32 community-based providers in our ATR network that provide recovery support services.
Wonderful.
Of the type I mentioned: adult basic education, nutrition, peer mentoring, spiritual faith-based coaching. We also offer transportation in the form of tokens through cost reimbursement to those providers, so people can get to and from the services that they select. So essentially, we have a whole network of providers that are working with us around folks in recovery in the community, and the recovery specialists are the backbone of the program because they link those individuals who select services to the programs of choice.
Absolutely. Key responsibility. So,
Absolutely.
now you've reached an important milestone recently in the program, haven't you? As far as your numbers, you want to talk about that?
Yes, absolutely. As mentioned earlier, this whole program hinges upon us doing a certain amount of GIPRA follow-up surveys. The expectation from the Substance Abuse and Mental Health Services Administration is that we'll do at least 80% GIPRA follow-up surveys on all the enrollees in the program.
Mm-hmm.
So to date, we've served maybe 6,900 out of the 10,705 people that we're targeting in this intervention over the course of 4 years. That's about 64% intake coverage.
Mm-hmm.
And on September 29th, which was the last day of year 2 of this grant, we achieved an 81% GIPRA rate, which exceeded the federal expectation by 1%.
It's commendable.
Absolutely. And it's extremely difficult following people over the course of a 6-month period.
I'm sure.
We're targeting specifically people who are experiencing homelessness, individuals who are entering from the criminal justice systems, that will include state, county, and fed, women who are parenting and are pregnant, and veterans, all with primary substance use histories or challenges. So it's quite difficult for our specialists to, number one, develop rapport with individuals and maintain contact over the 6-month period. That's why we thought it was essential to hire people with those lived experiences, because we felt they could relate much better to the target population we're serving at this point.
So what are the challenges that the recovery specialists face in actually following? I imagine people change residences.
Well, folks are extremely transient, particularly those experiencing homelessness and folks coming from criminal justice systems. A lot of times folks change phone numbers quite frequently.
Okay.
So those are some of the initial challenges we have with the demographic information we have collected. But we developed some systems where people can call into our office pretty much at any point in time and remain connected to our recovery specialists, because essentially the specialists manage the vouchers for those individuals enrolled in the program.
Okay.
And the vouchers just pay for services, and people get to select services of their choice, and they can have multiple services on their vouchers. So this program is really for people in recovery who are ready, willing, and able to attend recovery support services that will help bolster their recovery.
Absolutely. Anything else you'd like to add about the Access to Recovery program, Rick?
It's been my experience over the course of the past 2 years that this intervention is essential for people to maintain recovery. Oftentimes individuals may engage in one mode or another to stabilize themselves if they happen to be in addiction, but all the literature states that people need to have multiple interventions at their disposal if they truly want to recover in the context of the community. So I believe essentially that ATR should be around long after we finish this 4-year grant in some form or fashion going forward.
Absolutely. Well, Rick, thanks for coming and talking about ATR.
Thank you, Gary.
You guys
Thanks
are
for
doing
having me.
wonderful work.
I appreciate you.
Ricardo Tull, Access to Recovery Program Manager.